We heard that at our meeting.
I don't know.
We heard that at our Commission on Aging meeting, that somebody was filling their tank up.
Why they take a picture of Scott?
I didn't hear anything.
Oh, no, that was from
Officer or
Tax
what?
Services.
I don't know.
No, he called and said he couldn't make it.
Yeah, not from,
Well, it was the Commission on Aging, and together with
the driver.
the driver and
Here's some signage for you, Ruth. Whenever.
Right.
drives the Bush Industry.
Why they taking a picture of you? Are you employee of the month or something?
I don't know what's going on there.
Yes,
My presentation is
Oh, that's wonderful.
I can pretend I'm
I don't know.
That's wonderful.
Oh, don't look at them. Can I smile? Okay. Yes. Hello. Is that good?
I didn't figure this was too late anyway, so I'm just taking off.
Oh, Jerry.
Thank you.
Oh, they're terrible.
Oh,
Them and the box elders.
I was with the guys today running, ran backhaul there.
Sure.
It's like,
I'll do
yeah,
some.
just,
As long as you don't mind them looking a little used when you get it back. That's
Everett's got a good point here on this.
How come we have a closed door?
Get a closed meeting.
Thing shouldn't be counted
I'll recycle them.
I don't need to listen to Dawn.
for meeting duration.
Their budget.
Did you go lean on your shovel yesterday?
They have to leave
No,
at
you?
8 o'clock in the morning to go to
Wait, a
Wausau.
Hancock? Are you kidding? It's
She'll be
nice
home
weather
at 3
it
in the
was.
afternoon.
I hated to leave today.
75 if it's,
Been that way every time around here, that's 15 years.
they didn't call travel
There
times.
was one year I
Got
voted.
3 hours on the road.
Well, one year Joe and I and three or four of us.
Same thing, you know, Maryland's way to hell up there. Or Milwaukee.
There's four of us.
It's really odd. It is.
So you were pulling backward.
Majority means they were.
No, I grew up in a farm. It's perfume. My cousins, come on, scoop. We used to tell them this.
Don't you got a gavel?
Gotta get your gavel. She said you gotta conduct the meeting next month. She's gonna be AWOL.
I got a what?
Were they bulls or heifers?
When we had our meeting.
Order, please. Now we'll take roll call. Mrs. Krantz.
Here.
Mr. Heisey.
Here.
Mr. Tim.
Here.
Mr. Mastrocola.
Here.
Mr. Eckstein.
Here.
Mr. Weddy.
Here.
Mrs. Coletta. Here. Mr. King.
Here.
Mr. Wadle excused. Mr. Rothamel.
Here.
Mark Kirschner.
Yes.
All right, let's stand for silent prayer and pledge of allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'll entertain a motion to approve the agenda.
I'll move to approve it,
By Weddy?
the amended agenda.
Pick one?
No, you just got it.
Doesn't? Then there was 2 on my desk. I thought one was amended.
I'll second his motion.
Okay, we have a motion and a second. Any questions? All in favor?
Aye.
Opposed, same sign. And we need approval of the minutes of the September 29th, 2015 special 2016 budget meeting.
So move.
Motion by Jerry,
I'll second.
second by Barry. Any questions or comments concerning the meeting minutes? None? All in favor?
Aye.
Opposed, same sign. I have no one registering for public comments.
base with you on some of the trends I'm seeing, and then really give you the opportunity to ask me questions. It really doesn't do you a lot of good if I just narrate up here and tell you what I'm seeing in today's office. I think you gain more of it if you yourself actually asked any questions. But to get us started, what I wanted to do is touch base with you on some of the trends that I'm actually seeing in the DA's office, some of the things we do, and some of the things that have kind of changed over the last couple of years as far as where we investigate certain cases and how we investigate them, and the personnel that we use to investigate them. There's been some trends that we've seen. One of them is an increase in internet crimes. We're doing a lot of them now, a lot of internet crimes, and they are coming through almost as many as you'd want. I think Jeff would testify to the fact that we essentially have one person that can do that full time. These are crimes many times of a sexual nature or a fraud nature occurring over the internet. They're high tech, they're very in-depth, and they take a lot of time to investigate. How it works is that we actually get cyber tips from the federal government, websites themselves, or monitoring agencies give state authorities, Department of Justice, a tip. A tip means that they're monitoring some sort of back and forth communications on the internet. They're seeing images that are actually potentially child pornographic, and they think that there ought to be an investigation. That gets kicked to the state of Wisconsin Department of Justice, and then they kick it out to our local detectives. And under the rules that we're burdened under, to a certain extent, we have to investigate, or at least a detective has to make a good faith effort to investigate every one of those cyber tips. The point being is that there are a lot of them now. The last time I checked with the clerk's office, I think we had 28 subpoenas up to August 31st of this year issued for records to internet agencies. I would say about 24 of them are all for internet crimes, cyber crimes, and sexual exploitation crimes. These are people that are asking for child pornographic images, exchanging images, trying to solicit contact with juveniles and alike. The bottom line is it takes a lot of time. It takes about 3 to 4 months to investigate those cases. It takes a lot of subpoenas and warrants, and then it takes a lot of time to digest what you're getting back. And so what I wanted to do is kind of show you what one file looks like. In this case, it's still ongoing, but the point is that this is just one file. And it's what my office and detective worked on between March until August of this year. And just on one internet case, you get thousands of pages of discovery that all have to be looked at and reviewed for the images, for the IP address, and for jurisdiction. It's taking a lot of time, but that is kind of where we're going with some of these crimes, and we're seeing a lot of them now. In fact, I think DOJ will tell you that it's almost as many as they can keep up with. You really can't keep up with them. There's just a lot of internet crimes that we're dealing with right now, and they're complex investigations. It's not like a burglary where you just go to a home and you climb the door, you bust the prints, look for witnesses. These take a lot of time to develop, but I'm seeing more and more of them now, and I think we're going to see a lot more in the future. We now have an investigator in our office, which helps us hash a lot of that data. It's virtually impossible, guys, for us to flag all the things that we're looking for. In this case, you can see Post-it notes. This has just all been flagged by an investigator. Certain things that we're looking for that we're going to tie back to the case, and it takes time. Probably took him almost 2 weeks to digest all this information. And that's what he's doing for my office. But that's kind of a trend that we're seeing, and I think you're going to see more of it. Those crimes themselves are almost all felonies. A lot of them have minimum mandatory penalties on them. So they have some real clear weight behind them. Another of the trends that are still ongoing, I guess, is we're still fighting kind of the heroin war. I don't know that that's going to go away. That continues to be a problem. We've been really aggressive on that. A drug officer that's come on board approximately 18 months to 2 years ago. Been very aggressive, doing very well, and doing a great job at trying to interdict heroin. But I would tell you this, is that it's a very difficult drug to really stop because unlike the other drugs that we have, whether it be cocaine or even THC, these people that become addicted to heroin really become dysfunctional. You can actually do cocaine and still somewhat be functional, have a job, still kind of be employed, maintain a home. We find with the heroin addicts, they really become completely unfunctional. They don't have a driver's license, they don't have a home, they don't have a job, they are completely addicted to it. And so it's become very difficult not only to intercede, to interdict, to charge them, and then to get them to stop. I guess the way of saying that is many times when we charge them, they don't stop. They continue to use the drug even though they're charged with felony offenses. So it's really hard to try to interdict and stop that drug because there's really no break in the timeline. Because once they're addicted, they don't leave it even though we may be charging and convicting them of them. They stay in that lifestyle. I wanted to bring to you, I guess, a copy of what heroin looks like. Sometimes people really ask me, what is heroin? What does it look like? How does it come about? What is a bindle? What do they mean by that? So what I want to do is just give you a picture. Heroin's nothing more than kind of a brown, chalky type substance. I'm going to give you some pictures of heroin as we found it on recent buy bus. They come in bindles. They put them together in a little twiggy packet. You chop up the heroin. It usually comes in like a block with a razor blade. They cut it with chalk. And then they wrap it into like a little piece of paper or into what they call a bindle. It's just a piece of aluminum foil, something you might put a sandwich in. They wrap it up really tight, and then they sell these little bindles, which is like a tenth of a gram of heroin, for about $30 to $40 a piece. And that's what heroin is. Many times they ingest it. Everybody always thinks that they're ingesting it by injecting it. That's really not the case. A lot of people are actually snorting it through their nose, so they're inhaling it. But you can inhale it as well. But many people inhale it with a snort straw as well. So that's heroin. We did have our first methamphetamine lab. We've had meth here in Waushara County, which means people are using meth. They've been caught with meth. We've got it in cars. We've also got it in their homes. We do search warrants. But we've really never had a lab. We did have a lab about 2 months ago, or maybe a month ago. And so what we did is we did execute a search warrant, and we did find a lab. It was a makeshift lab. It wasn't a big one like for CMT. It wasn't like Breaking Bad or something like that. It was a smaller one, but still was a methamphetamine lab. It was significant enough that this person was able to, in our opinion, use and even distribute to some of his friends. How that works, methamphetamine is really based on pseudoephedrine. And so what they try to do is they get pseudoephedrine, they become pseudofed, they buy it from Walmart. Generally, they have a little crew of people that buy for them. So if it's one male, he'll probably have his girlfriend, maybe his brother's girlfriend, all buying a lot of pseudoephedrine. They got a sign for it. They only get so much. They bring it back, and then they extract that pseudoephedrine from the pills and make methamphetamine out of it. The process itself is really kind of, I don't want to say it's messy and kind of hard work. It is. You need to break apart lithium batteries to do it. It takes iodized salt. It's a lot of work. It would seem to me to be better if Liz had a cocaine habit. But in any event, to show you what methamphetamine looks like, I do have some pictures of that because many people have never seen methamphetamine. Now, in my opinion, we're going to see more of that coming through the county now that we have labs and we do know that people are involved in that. The band is full of it. And so I wanted to show you a picture of what meth looks like. It's just small, powdery crystals. And I'll show you some of the ingestion methods. And then we still have the standard cocaine cases. This is a recent cocaine buy that another officer had actually worked on. Cocaine is much like methamphetamine, but it's a white powder. And it's a bit more granular. And it has a different effect. But they're all about the same size and quantities. There is a difference in value, how they're distributed and the like. But that should give you a visual of what we're dealing with. So I guess if you're looking at trends, heroin's going to be with us for a while. I think methamphetamine is probably going to be coming and more prevalent. It is a highly addictive substance, and we'll be dealing with that. And I think we've made a real concerted effort to try to root that out as best we can right now, and we're working on that. But that's something that we're looking at. We're still investigating marijuana cases. I'll tell you that they're different. They're different and difficult now. There's been a real change in how people view marijuana cases. We're still prosecuting them. We're still doing what we need to do. But people are just looking at marijuana differently. I mean, when we charge them with possession of marijuana, some of them are outright angry. They're almost upset, like, what are you doing? You're busting me for my pot. The fact that it's legalized in some states has really undermined our ability to prosecute and enforce marijuana. Just because they can always throw that up as, hey, it's legal in certain cases and medicinal in other cases and alike. It's like I have a lot of people now in court who claim they have glaucoma, a lot of people that say they're using it for their appetite, a whole heck of a lot of people with Parkinson's. Everybody's got something now, and it's always for marijuana. If you want my take on it, for every one person who actually needs marijuana medicinally, there's probably another 80 who are just smoking it to get high, and the rest are all lying. I'm just giving you my 2 cents. But it's been a difficult road lately because of the fact that some of the states have chosen to legalize it, and there's been some of the stigma lifted. We have a lot of people also telling us that their doctors are somewhat condoning the use of marijuana, which really has the professionals kind of pitted one against the other. I mean, if the doctors are telling that to certain people and we're trying to enforce it, we're not on the same page and it's not helping. Restricted controlled substances, and then I'll end you with that. Those are your prescription meds. As far as trends go, we had saw probably 6, 7 years ago a trend towards a lot of impaired driving offenses, and I think that's still there with prescription drugs. We're just seeing a lot of cases where people are involved in crashes, traffic accidents, and the like, and it's not because of alcohol. It used to always be alcohol. Now it's a lot of prescription pills, and they're ingesting that together with alcohol, and they become what we call RCS cases. RCS cases are almost like OWI, but drug-like cases. Instead of dropping while impaired, dropping with restricted controlled substance, either be heroin, THC, or some prescription medications, usually something like diazepam, clonazepam, oxycodone, Percocet, that type of thing. These people are highly impaired, and I think Jeff can testify to that. You know, we always had the traditional drunk that would crash into the tree, but some of these folks that are on opiates and alcohol are highly impaired. Sometimes unconscious behind the wheel. Some of them are just driving off the road and passing, just nodding off is what we call it, just on an opium nod off. They're just driving off the road. So that's, I would say, almost 25% to a third of some of the cases that we have involving accidents now. So I don't see that really changing because there's just a lot of prescription medications out there. But the point I'd make on that is that those cases are tougher and tougher to prove because the results I got to get for them come from different labs, and they cost a lot of money to get those experts here to testify. And so if there's any kind of issue I would have, it's that the state has an analyst that comes up for free for alcohol. When I try a case, they'll come on up, and that analyst won't owe them anything. They'll testify. The alcohol in some ways is left to them. But for the drugs now, which are so many of our cases, they usually farm that out to other labs. And those labs have experts that would have to testify about what they may have found. Very nasty for the drug. But when they do that, they charge a big fee. And that's made some of these cases much more difficult and hard to prove. The last issue would be, as far as trends are going, we always had issues with domestic violence cases where we know that people are, in fact, recanting, which means we have victims that we know were victims who are, in fact, had domestic violence perpetrated on them, and they recant, which means they say it didn't happen, and they try to backpedal on the beating they may have suffered or any kind of trauma that occurred to them by the defendant. That's always been the case, but we've never really been able to try to get a handle on it. So with the investigator that we have in our office, Jeff has been nice enough to let them
says, under the present DEA rules, under the present federal rules, people can apply for a license to manufacture marijuana and extract from the marijuana the part of it that is the medicinal part of it, the part that's supposed to take away the pain or whatever. So there is a process. The problem that people don't like with that extract is it doesn't give them the high as if they were to smoke it. So when people say they need marijuana for the medicinal purposes, it's a bunch of bunk because they're getting high and they can get the medicinal purposes from the marijuana if they go through the process or if it's been processed by a legitimate lab or whatever. So this medical marijuana is, they're really pushing the limits of what it really is for.
You know, and I don't know how they get the benefit. I really don't.
No, I just wonder what it's supposed to do.
It's supposed to be the cure-all for everything.
Do you have glaucoma ever? Do you have glaucoma? I got a question. Where they've legalized, such as the state of Colorado, I've read some articles where they're actually running into a lot of real problems there.
Yeah, the verdict's still out on that. I don't think they'll be able to get it there. Because when you legalize that, you're basically condoning that type of behavior. You're just going to get a lot of people that overindulge in that. And that type of drug, they won't realize it taps all their energy. And instead of teaching your kids to read, you sit at home and smoke a dope. Instead of trying to build your business, you sit at home and smoke a dope. You know what? That'll reach that. You're just kind of melting your way through life. And that's really going to get especially good long-term cancer people. And it is addictive. It is highly addictive. If you want to ask that question, and there's a debate about that, by the way. There are people who will literally debate that marijuana is not addictive. But the drug court that we have here in the sheriff is filled with people who will get up and tell you that at night they can't sleep. They almost dream of it. They think of it. They can't sleep without it. Long-term cannabis users and how they will tell you that they almost have tremors when they stop smoking marijuana. So if you want to debate on whether or not it's addictive, just go to the drug court and answer that question.
I think you do an excellent job of getting people prosecuted, but what finally ends up happening is you get them a 1-year sentence, or they would have a 1-year sentence for something, and the judge will stay that sentence and give them 1 year of probation. Don't we have room in our jail to put some people in so they know there's going to be a penalty, that you're going to have to spend some time in jail? You know, rather than just let them go and a slap on the hand. They're right back out there doing the same thing they were doing the day before they went to court.
Start tomorrow, 8 o'clock, and you can come right on in. It sounded kind of a lot like me, and I know I totally get it. I totally understand it. And so I think at times we're trying to, at least for those people who are not violent, I think the court's opinion would be to see if they can try to dig themselves out of the hole or better themselves. And if they can't, then they're going to get revoked, and then they're going to do their jail time. So it's almost like one last time to right the ship. Maybe is what you're thinking there. But there is room. We can handle down this case. It's just a matter of how we want to address it. And those debates all over, whether you drop the hammer the first time you give them a little bit of time. That's the issue.
Well, give them 30 days or give them something, you know, just don't slap them on the hand and send them back home with some kind of a bracelet or something, you know, that they need to have a penalty of some, you know, a little more severe penalty, I think.
You know why that works, Mr. Heisey, because you're logical, okay? If you realize that Goodman and I do, he's like, comes to the system totally logical. You can't speak with them on a very basic level. And when you tell them that they're actually going to jail for 30 days, sometimes they don't connect the dots that the heroin is voluntary. They believe later they're going to turn over, and it may be. It's very hard for them to connect the dots. My opinion, I agree with that. But I'm with you, heart and soul. I agree with you. Any other questions?
Listening to you talk, the investigator's working out real well, Scott.
Yeah, it is. It is. And what he's addressing is that we have an investigator in our office now that works on some of these things. And it takes some of the pressure off. There is so much data now on these cases. Almost every case has a phone now with it, whether it be heroin or sex plant cases. And then you get the phone returns back. After the attachment, there's thousands of pages. And all you're looking for is just a series of connections between your coworkers or a certain image. The data, you're just sitting and looking at that, impossible.
for having us here tonight. We're going to do things a little differently this year than in years past. We've done a PowerPoint, and each department, each supervisor of each unit came and would, tell you a little bit about what they do. But this year instead, we decided that I'm going to give you some information, a little bit of information. We're going to review it real quickly. And then we have an individual here who's participated in many of our programs and is going to give you a firsthand account of her experience working with us. We thought that might be a little more meaningful and kind of give you a face with at least one person that we've worked out with of the many. So before we do that, I'm just going to ask all our managers to please stand up, introduce themselves, and let the board know what you do. And then we also have, right now we're advertising and interviewing for a CCS supervisor. That was formerly held by Clint Starks, who works for CCS and CSP, which is our case management for folks with a mental health diagnosis or substance abuse issue. And Dr. Morgan Jones is going to be taking over our community support program as part of her job function. So we're still one manager short, but we're getting there. So. So what I'm handing out is actually an article that was in the Argus back in June, I believe, June or July this summer. And it kind of breaks down, just real briefly, some of the things that we've been doing here. Did you got an extra one? There we go. Got enough? Okay, great. So basically, sorry, no. So what did we do in 2014? How is Waushara County Human Services working for you and the citizens of Waushara County? We assist approximately 2,700 households, help them obtain and maintain the state and federal benefits that they're eligible for, such as medical assistance, food share, and child care assistance. We provide about 1,000 residents with mental health therapy, substance abuse counseling, psychiatric, psychological evaluations, professional mentoring services. We actually renamed that intensive support services, I believe is what we called it. But anyway, that's really an intensive program to help people one-on-one. Responded to 594 calls for Waushara County residents experience personal crisis in 2014. All of those needed some sort of emergency assistance. We responded to 451 reports of child maltreatment, and as a result of those, or ones left over from 13, we had approximately 30 children in out-of-home placement. Those reports included physical abuse, neglect, sexual abuse, unborn child abuse. In 2014, we completed 114 operating while intoxicated assessments. We served 26 court-ordered participants in our underage drinking class. We assessed 140 adult protection services referrals. That included concerns of abuse to vulnerable adults, elder abuse, financial exploitation, neglect, self-neglect, and sexual abuse. Those were of vulnerable adults and elders. We worked to keep Waushara County safe while meeting the needs of juveniles and their families by processing 119 referrals regarding crimes committed by juveniles in 2014. We provide approximately 30 adults and children with mental health diagnosis or alcohol and drug abuse issues with such services as case management, medication management, mentoring, other programming to assist them in their pursuit of recovery-oriented goals. That program is the CCS program that I was referring to there. It's actually 31 now people we have participating, and that ebbs and flows. But you've heard a lot about that program, and there's a resolution for you tonight to vote on regarding that program. We served about 35 additional adults with severe, persistent, disabling mental health issues by providing them with such services as symptom medication management, independent living skills training, and opportunities for positive social interactions. That's our community support program. I've talked to you about that program before. That's for folks with severe, persistent mental illness that have a history of being hospitalized. We recruit, license, and maintain foster homes. Right now we have 12 foster homes that we oversee. And then, of course, we collaborate with the state of Wisconsin, private funders, agencies, other county agencies, regional partners, to really try to provide the best possible service with minimal expense to Waushara County taxpayers. We collaborate and provide Waushara County residents with free or low-cost services such as parenting classes, in-home parenting and safety programs, case management, information referral services for the elderly, disabled, and vulnerable. We are co-chairs of the Waushara County Prevention Council, and we're active partners in sponsoring community events that help benefit everybody, or a lot of our residents anyway, such as the Back to School Bash, Blue Ribbon Kids Day. We're active partners in the Treatment and Diversion Program. That's the drug court that Scott was talking about, and that's also the Safe Streets Program. We have the Backpack Nutrition Program. I believe that's in 2 of our schools right now, and we could looking to possibly expand that to give some low-income kids food resources over the weekends. And then finally, we work with county and regional partners to promote the health and economic growth of Waushara County. Any questions on that before we get to our consumer presentation? Yes,
I have one. How many families are served with that backpack nutrition program? No?
Last I heard from Jan that we served about 100 children last year in 2014 with the backpack program.
And what school districts are you working with?
I believe that's, Tri-County, no, I'm sorry, excuse me. I believe it's Red Granite, and I think, is it Tri-County? Is it Tri-County? Yep, so Red Granite and Tri-County. Any other questions on that before we get to the next section? Okay, then I'll invite Sue up, please.
I think this was so interesting to hear what the district attorney was saying, because he was talking, did you notice that he was talking about all of their trends are pretty much drug and alcohol related? And really ties into what we're seeing in our office. We have a longer waiting list for people with substance abuse problems trying to get help than we do with mental health problems. And so we're pretty excited tonight to introduce you to consumer of our services. And I'm a substance abuse counselor, so that was part of her struggle. But this is Tia, and Tia would like to tell you a little bit about the different services that she was offered through our agency and how it's helped you, and a couple of her social workers who she's probably loved some days and hated some days came along to support her in the back, Sarah Voigtlander and Banky. So go ahead.
Hi, my name's Tia Bordeaux. I'd like to start off by thanking Sue Szymanski, Clara Voigtlander, and Andrea Banky for trusting and believing in me, and also asking me to speak tonight. It's a very big honor. A year ago, I was very suicidal, extremely depressed, resistant, neglectful of my children, a selfish mom, an abusive and hostile marriage. I could go on forever, but I don't want to. So, and then one day, I got a knock at the door, and 2 women named Sue and Clara were on my doorstep. I had no idea that I had CPS and an AODA counselor at my door. After much resistance and denial on my part, Sue and CPS slowly helped me realize that I had a drug problem, and I needed their help. With their no-nonsense, honest, and determination, I began to trust and appreciate them as time went on. As I began my new journey, a clean and sober 28-year-old mother of 2, I was extremely blessed to participate in many programs Waushara County has to offer. I'm involved with CPS, mentoring, AODA, OD groups, and CCS. Without these programs provided by the county and the employees that believed in me when I didn't believe in myself, I wouldn't be where I am today. Today I have 350 days clean, or 11 months and 16 days, completely substance-free, along with a whole different outlook on life. I regularly attend 12-step meetings at least 4 times a week. And thank you again to Clara, Sue, and Andrea.
We just want to thank Tia again for coming. You know, we can tell you all day long about all our successes and what we do for people and how important it is and give you numbers. But unless you really see it, you know, day to day and face to face, and we have, thankfully, we have many stories like Tia's of, you know, where sometimes they don't always say thank you at the end, like Tia has nicely done, but really a lot of successes, and we're just really proud of our staff and what they've been able to do and work with folks, and really appreciative of people being willing to work with us. We're going to be, if you can notice in the Argus this week, we also have another article of some of the things we've been working on, some more successes that we're really trying to highlight. But again, I think we could tell all the stories we want, but unless you see it and really experience that face to face, it doesn't have nearly as much meaning. So, yes, please do.
I'm thinking about Kate Surprise sitting here too. One thing that's really changed in Tia's life is that she did not work a year ago. She's now employed full time. Has been for probably 6 months or more, 6 months. And as we could see that she was very serious about her own recovery from her addiction, and you know, she was willing to try anything we suggested, even though at first she was fighting us on it a little bit, you know. And so one of the things that Kate's office has helped with is now we just helped her move into a much nicer place. She didn't have the nicest home for raising her kids in, so she just got to move into a really nice place. And I think your department, the Economic Support Department, has helped her out a little bit with that. But we also have the agreement with her that we can help you because we know you're going to be able to pay us back a little, so that we can help her with a security deposit and she can pay us back, and we have a plan worked out. So it's really nice to be able to do that for people. You know, otherwise it's hard to start out when you have nothing and you have 2 little kids to support.
Do you guys have any other questions for us or anything else that you'd like to see from our agency as far as reports or in the future? Okay, that's what we have. Thanks.
Next, we have discussion of possible motion action item and County Board Supervisor compensation for 2016 and 2018 terms. And that was in your packet.
Madam Chair, I make a motion that we use the same fees that we had in the past 2 years.
I'll second his motion.
We have a motion and a second.
Could I?
Okay, now, okay.
I'd just like to
We'll
mention,
open it up to,
okay. Can I?
So go ahead.
Okay. I would just like to ask that, part of this discussion is that we're trying to get away from actual paychecks and go with direct deposit. Thank you, Mark Kirschner, for switching that. But, you know, we would really like that everybody does direct deposit, so out of 400 and some people, we cut 1 paycheck. Everything else is direct deposit. So it would really be nice if we could just do everything direct deposit. So I guess that would be one of my suggestions, is that that's the understanding for the next term.
I held out for as long as I could.
I know. Thank you, Mark.
It was do or die that day, let me tell you.
Margaret.
I've attended meetings, and so have a lot of other county board supervisors, where you've got an hour and a half run to wherever your meeting is, and obviously the same distance back. And if you don't, you can spend a whole day at the meeting and still only get that $50 per diem. I really would like that travel time added to the time of the
problem with that is when you have a minute taker, you have a start time and a finish time, how are you gonna keep track of that? Officially keep track of the travel time? No. Do you want the short answer? No. I just don't know how you're gonna track it.
About putting a distance in that, you know, if it's 60 miles or more. That's an hour.
So you do record your mileage for
Right.
mileage reimbursement, so we can work off of that.
Well, it's just, somebody has to monitor this, so the more twists and turns you put in this stuff, the more that we have to spend time doing the accounting on it, so you guys tell me what you want, and we'll figure it out.
I think some of the meetings that I've attended to, you know, whether it be here or where, the agenda has times on it for each amount, you know, discussion and so on. Like, and some of those are like, you know, a 3-hour meeting might have, it might note on the agenda itself how much time is going to be spent approximately on each item. Would that be of help to you if you were in?
No, the minutes themselves are supposed to
minute.
supposed to reflect a start time and an end time.
I see.
And so, but if you add the travel time to that, I'm not gonna have any way of monitoring that. So it really will just be an honor system, because there's no way to monitor that.
That wouldn't work with the mileage.
Driving you're doing.
I didn't hear what you said, Barry.
I think that might be hard to monitor depending what type of driving you're doing. 60 miles or 60 miles through one type, I mean, if it's strictly highway is one thing, but are you gonna be caught in traffic? Are you gonna be in town? Where are you gonna be?
That's the way, no, that's, a lot of times I'll run in here, charge my 26 miles, 13 each way, and ride with somebody here, and so naturally I don't get mileage, I don't expect mileage.
No, but you
But
still
that's
got,
mileage.
you still have the time
You want the
invested.
Yeah, I
time.
know, I'm
But
thinking,
then, like, how do you, like, track the time? So if you and Dennis are both at the same meeting, if he has 200 miles and you have 26, but you don't turn them in at the same day,
Yeah, I'm not gonna know.
they're just process, you know, because you just kind of look at it.
That's all you can do.
I will tell you that I attend East Central Planning meetings, and they pay my mileage, and they also pay my per diem. It doesn't matter where I come from, I get the same, you know, I get the mileage, of course, but I get the straight per diem amount, no matter if I come from Waushara County, or if I, you know, come from Outagamie County, you know, to Menasha. So it just, they do not pay.
I don't see any way of, I think a flat fee is the only way you can do that. There's, like you said, a per diem to mileage. I don't know how you would, travel time can be put in there and made sense of. I think there's so many variables there that would,
That's what I said to Gary, you know, I don't know how you're gonna keep track of it, you know, it's just gonna be, you know, if you went with.
and I certainly understand, Everett, where you're coming from on that, but I don't see with the variables involved, I don't see how you're gonna be able to work that in. And I really don't think that should be an honor system, because I think you open a bag of worms for down the road, I really do. I think that should be cut and dry and be done.
I made a motion to amend my motion, but there was no second, so that will die. So we will go back to our original motion. Is that correct?
Well, I should have seconded your motion too then.
No.
I think that-
This way it died now. And now we can go back to our original motion, correct? Okay.
So do we have any other questions or comments about this?
So can I require the direct deposit? That is what our policy is. Can I require that, starting with the next term?
You want that as
to do that. It's time.
Of course you do.
Shouldn't that be a separate motion?
I think it should be.
All right, the motion on the floor is to adopt this compensation, the current county board compensation as is. And do you want to roll call vote? Yes, please. All right.
Okay, we're starting with Mark Kirschner,
Yes.
Mrs. Prince,
Yes.
Mr. Heisey,
Yes?
Mr. Tim,
Yes.
Mr. Mastrocola,
Yes.
Mr. Eckstein. Mr. Weddy,
Yes.
Mrs. Solana,
Yes.
Mr. King,
Yes.
Mr. Rothermel,
Yes.
It's interesting that he abstained.
Below the road, huh?
Okay, now Deb, you want a motion,
Well, that is the policy. It has been the policy for a long, long time, and we make all of our employees do that, and I would just ask that we do that for this body also.
How many do you have that don't do direct deposit?
One person.
You don't know who that?
Russ, there was two of us and they got me, so you're next.
I guess I'll have to donate mine to someplace then.
Russ,
So what do we have to do? What if I don't?
Basically, all you have to do is set up a savings account or a checking account somewhere.
I have a business account, but I don't let any of my personal stuff go in my business account.
That's why you have two of them then. I have two.
And then they charge me a fee if I open up another account.
I'll go to another bank.
Russ, I agree with you 100%.
Why did you give in?
They wouldn't let me out of her office. They hog-tied me right there. You're
Yeah,
good at it.
You're next, Russ.
And then I had my wife
You're
along
next.
with me also, so I was really hung.
What about the per diems you pay to citizen members of committees?
They're
Are
all
they
set up with direct deposit.
They all direct deposit?
All are.
Plus, I'm looking for a beneficiary or something. Well, I guess, when will it take effect? With the new election?
Yes.
Oh, then I don't have to run, I guess. I'll let Bill come back.
all right, we need a motion.
Motion we do all direct deposits in the county.
Motion, is there a second?
I'll second that.
Any other questions or comments? All in favor? Opposed?
No.
Sorry, Russ.
Maybe it's
I'll
called
help you do the paperwork.
How much to it?
We'll lock the two of you in Deb's office.
There you
until
go.
we get it all
There you
straightened
go.
out.
Go to any bank in Watoma and it's fine.
Now we have consideration of possible action on the following resolutions and ordinances.
Resolution number 30-10-15, resolution to repeal statutory provisions in the state of Wisconsin 2015-2017 budget relating to shoreland zoning standards. Refers to some sections.
I move to approve.
Motion by Weddy,
Second.
second by Mastrocola. Any questions or comments? All in favor?
Aye.
Opposed?
Resolution number 31-10-15, acknowledgement of Brenda Ruby's service to and retirement from Waushara County.
We have a motion to approve.
I make a motion we approve Brenda's service to retirement.
Second.
We have a motion
A second.
Ken, second by Weddy. All in favor?
Aye.
Opposed, same sign.
Resolution number 32-10-15, resolution authorizing transfer of funds from general fund to EMS budget for construction of Hancock Station.
Motion by Kirschner, second by Rothermel. Yeah, we need a
Discussion?
voice vote. Is there discussion?
Discussion?
Do you have any questions or
I think
comments?
that should go in buildings and grounds instead of in the EMS.
It's a EMS expense. So the auditor explained it that that is an expense that EMS is incurring. So basically, that's where it should show up for accountability to the taxpayers, because it is their expense. No, you don't.
I got a question for that. So, I guess, yeah, I don't understand why that wouldn't be in buildings and grounds myself, to be honest with you. As far as the distribution of funds and who has the overall management and control of the building once it's built.
Sarah and Melanie. So they basically would be the ones that would issue those checks, cut any checks. So Randy would see it, Brian would see it. They'd all have to agree that it's a legitimate expense.
So it would have to come to an authority within the county here before it would be garnered. Thank you.
Mrs. Krantz?
Yes.
Mr. Ivy?
No.
Mr. Tim?
Yes.
Mr. Mastropola?
Yes.
Mr. Eckstein? Yes. Mr. Wedding?
Yes.
Mrs. Plata? Yes. Mr. King?
Yes.
Mr. Rothenmel?
Yes.
Mr. Kirschner?
Yes.
Okay, motion carries. Resolution number 33-10-15, resolution authorizing Waushara County to enter into a cooperation agreement for regional CCS program.
Motion by Eckstein.
Yes.
I'll second that.
Second by Bernadette. Any questions or comments concerning this? All right, do you want a roll call vote on this? No? All in favor?
Aye.
Opposed, same sign.
Abstain.
Ordinance number 588, ordinance amending Waushara County zoning maps pursuant to the authority granted in Chapter 58 Waushara County Code, zone change for Kenneth and Lua Ellen Reimer, or Reamer, I'm not sure which, town of Mount Morris.
Move.
Motion by Wedding,
A second.
second by Mastropola. Any questions? All in favor?
Aye.
Opposed, same sign.
Ordinance number 589, ordinance amending Waushara County zoning maps pursuant to the authority granted in Chapter 58 Waushara County Code, zone change for Plainfield Farms, town of Plainfield.
So moved to approve.
Second.
Motion by Mastropola, second by Rothenmel. Any questions? All in favor?
Aye.
Opposed, same sign. All right, we have board suggestions for future agenda items. Now, can we clarify, okay, for the motion for the money to go into EMS budget, that will be a separate account, a separate building account, so it won't be mixed in with everything else. It'll be
Right.
handled separately
Yes.
from everything else.
Right. And actually, those accounts are already set up from previous, there's been previous conversations over the years, so.
Okay,
There could be no transfer of funds from one account to another without coming here first.
Correct.
all right, next month, our next meeting is on November 10th, 2015 at 7 p.m. It's a week earlier than usual, and it will be the 2016 budget public hearing and monthly meeting. I will be out of town. Mark will chair the meeting.
I have to be in Green Bay that day, but I might be late coming here, but I have to be in Green Bay all day that day.
Mary.
A couple months ago, it was suggested that we have a representative from the Department of Revenue visit our board meeting to discuss equalization. Anything ever materialize on that?
I can follow up with that.
Town Lee and the Hallers made a big loop.
And just, you should have your campaign paperwork. I included, not that I'm trying to push anyone out by any means, but I included the non-candidacy copy paperwork in with that in case you decide that you're not running for another term. I always do that, so it's nothing personal against anybody on the board. And if you decide not to do that, those have to be in by December 28th. And if you are running again, you can't start circulating for signatures, the nomination papers, until December 1st. So.
There's a lot of rules.